Most women will get fibroids by the age of 50. 80% of black women and 70% of white women develop these benign tumors that grow within the wall of the uterus, according to the National Institute of Health. But if fibroids are so common, why then do we hear so little about them? The reality is that growth can be so small. They don't cause any problems, and many women never know they have them. But in certain cases, larger tumors can lead to unpleasant symptoms, fertility issues, and pregnancy complications. On today's edition of African Complementary and Alternative Medicine, we will be discussing necessary things to be known about fibroid and how we can treat it using complementary and alternative medicine. I am Oluwaseun Oyebade, and I welcome you to another edition of AFRICAM. I have with me today on set Mrs. Christiana Olakpade-Ojo, and with her we'll be discussing fibroid and how we can avoid it, what are the causes, symptoms, and a lot of things. Everything that surrounds fibroid, we are going to be discussing it today, especially the usage of African alternative and complementary medicine to address the issue of fibroid in our women. I welcome you to the program, ma. Good day to you, ma. Starting with the topic that we are talking about, fibroid. When looking into fibroid, is a thing that most women are battling with it with little or no knowledge about it. But to start with, when we're talking about fibroid, what can we really say is fibroid? So breaking it down to a layman understanding.
Thank you very much. Fibroid in the past used to be confused with pregnancy. At a point, it was called pseudo-pregnancy, which means false pregnancy. In Yoruba, it is known as oyun iju, which means pregnancy that is not pregnancy. So we really do not know what causes fibroid, but in layman's terms, fibroid is that thing that grows where the baby is meant to be growing, that's in the uterus. And for no reason, we don't really know why it grows. We don't know people don't know what they may do to stop it. Yes, there are medicines to, stop the growth, to remove it, to disintegrate it, and the rest of it. When fibroids are removed from the womb, we notice that it is made up of spongy tissue. At times, the tissue may look like it may be similar to liver when, you observe it physically. But of course, on breaking it down, we realize that it looks fatty at times spongy, at times, the bottom line is it's a growth, it's tissue growing in the uterus. But if we are to break it down scientifically, what exactly is fibroid? There are things that we call tumors in the human body. Almost everybody has a 50% chance of growing, whether male or female. We all have a 50% chance of growing tumors anywhere in our bodies in our lifetimes. Now, tumors can be benign and tumors can be malignant. When they are malignant, we call them cancers. And then when they are benign, they are just benign. They are just those things that grow for no reasons. Example, you have things like you see some growths at the back of the head of men. At times, it just grows for no reason. They don't know why. We don't know what causes it. But even though we say we don't know what causes these growths, going back to fibroid now, it definitely needs nourishment to grow, pretty much as the pregnancy needs nourishment to grow. So what particularly nourishes the growth of fibroid? In clinical observation over the years, we have come to realize that certain foods, certain drugs, certain things that we feed our bodies with tend to nourish the growth of fibroid.
Before we even move to that aspect, the age brackets that are susceptible to this fibroid, what are the age brackets of women that are susceptible to it?
Mostly it has also been observed that women within reproductive age are much more susceptible to fibroid, especially if at a point in their lives pregnancy had occurred, whether the pregnancy was up to term, whether it was lost or something in the process. So long as there has been pregnancy in the uterus, there is a higher chance that fibroid would kind of grow in that uterus when there is absence of pregnancy. So women within the age of reproductive age, and reproductive age for women begins as soon as they start to ovulate and menstruate. So as soon as a young girl begins that and then she becomes sexually active, maybe there is pregnancy at a point, there is every likelihood that she may develop fibroid.
But there are some myths that people carry about that it happens because of promiscuity, or once you are not a virgin then you can just get it. Is that, how true is that?
That is, as far as I'm concerned, data does not support such inferences, because we have seen people who have never been, but well, the population is quite low, so we may say that it's insignificant. But yes, we have seen people who have never been sexually active, and somehow this tumor has found its way into their bodies. But the few people that I have personally seen and interviewed, in the course of interview, we realized that, you know, they were on some chemical compounds that we call steroids. Steroids can be for any purpose. They can be for instance, the insulin that people use is a form of steroid. You know, there are so many steroidal things that we use for what's it called now, to prevent pregnancy. Many of these things are steroids because they act on the physiology of the body. Yeah, the family planning drugs or chemicals, they act on the chemical synthesis of the body, so they sort of alter the chemical synthesis. Who knows, maybe it is some of this alteration that triggers the growth of fibroid. Who knows? I am not saying it is, but it could be. So we have realized that for women who are in childbearing age but have never been sexually active and somehow they developed these tumors, they are known to have ingested or, you know, consumed these steroids at a point in their lives.
Well, some might say, and maybe that is why some people tend to procreate more and more, give birth several times, because of this myth again that if you are not giving birth as regular as you're supposed to, then the space that a child should be occupying, there may be a fibroid will develop there. So some people will say maybe to just avoid that. How true is that also?
Well, we cannot say anything is true or false. But basically, because we are meant to remain scientific, because, you know, science is logical, you can refer to data and evidence. Well, I believe that our ancestors who claimed or who believed that it is in the absence of fibroid, it is in the absence of pregnancy that fibroid grows. They must have made that inference based on their observations, just as many of the, you know, what we call myths. You know, a lot of myths that our ancestors shared were based on their observations. So they must have noticed that, okay, when a woman gives birth and, you know, she doesn't get pregnant again for a while, fibroid then sets in. Yes, we have seen that clinically as well. You find out that, for instance, a woman who has been giving birth, and then there's a pause for and you know how our own civilization is these days. You want to gap your children for 6-8 years, and then in that period the woman is battling with fibroid. Yes, I dare say that observation, that traditional observation, is right to an extent, because a lot of women, especially those who are on birth controls, when they gap their children, they struggle with some of this. They struggle with these tumors, with fibroids. And we can't say that because I believe that in the past, our mothers were not using these chemical birth controls, and somehow, because there was gap between pregnancies, they were susceptible to fibroid. But it is more prevalent these days maybe because of the drugs that is being introduced into the bodies to prevent conception. Maybe, just maybe. But obviously, there is a close relationship between absence of pregnancy, chemical drugs, and the growth of fibroid. There is a very close relationship that we cannot ignore.
Okay, now you were talking about some lifestyles that can predispose you to having fibroids. Now, as we have discussed some certain myths and clearing people's doubts on whatsoever it is. Now, what are the certain lifestyles that expose us to having a fibroid? Either as one is growing up, or maybe at middle age, or even maybe towards the point whereby the reproductive ages is passing away. What are the lifestyles?
Basically, the most important lifestyle that every woman needs to pay attention to is diet. Because diet is part of our lifestyle. The things you eat basically forms a part of your lifestyle. Some people cannot, for instance, do without eggs. And we have come to observe that eggs play a major role in the response of the treatment of fibroid, in the response of the tumors to treatment. When women consume eggs, a particular type of egg, it slows down the progression of treatment in fibroids. Now we got to realize, although when I spoke to some agric farmers, they told me that injecting birds to produce eggs has been stopped, or is now, it's been criminalized now, or something like that. And I really hope it is. When women consume what we call eyebile, which is the egg that chickens produce from eating leaves, eating natural things, we realize that it really does not have an influence on their fibroids. Whereas when they consume eggs produced as a result of, not just some, there was a time we were told, I'm not a farmer, so I don't know, I'm sure farmers listening would be able to relate with this. I was told that birds are injected under their arm to improve their egg production. Most of the time, these steroids that are used to stimulate the ovaries of the eggs, they are not things that the birds excrete with their poop. So they remain in the tissue of the egg, and mostly they will remain at the site where they are meant to activate production, which is the ovary, which is in the egg. So when we eat this chicken, when we eat the egg that they produce, whether we like it or not, we will be consuming considerable amounts of these steroids, and automatically the steroids are designed to activate ovulation and egg production. They are designed to activate, reproductive organs. So automatically when the woman eats it, it goes on to have an impact on, you see a lot of women developing ovarian cysts. We believe that, hyperovulation, let me call it that, will result in ovarian cyst, because when the follicles do not close up completely, it results in a cyst. And then depending on how the cyst progresses, it will result in, something clinical that the woman will need to visit her doctor for. And the same thing applies to the endometrium, the wall of the uterus. And the steroids are designed to, prepare the uterus of the chicken, to take in the egg. So automatically it will have an effect on the woman's uterus. That in a way may trigger the growth of this tumor. Based on these guesses, hypotheses, and inferences, we advise women to stop consuming chemically produced eggs, chemically induced eggs that are otherwise called genetically modified, eggs. So we discourage them, and then when they say, oh, they can't do without eggs, we encourage them to eat eyebile, and they respond better to treatment. But for those who don't, who stick to the genetically modified eggs, it is much more difficult, because they keep feeding the fibroid, they keep feeding the tumor, and we all know that tumor is a tissue of rapidly dividing cells. So when you keep feeding the cells with what it needs to divide rapidly and thrive, then it would continue. So no matter the treatment you are giving it, unless it's physically removed, no matter the treatment, nutritional treatment you are giving it, if what is responsible for the rapid growth is still there, then it will be difficult to manage. So egg is one thing that we tell people, try and stay away from it. And the same thing goes for other foods that are genetically modified, because they contain steroids. So we tell them stay away from steroids. Another thing is alcohol. Alcohol has a way of affecting the hormonal system, because whether we like it or not, just as in pregnancy, our hormones play a major role in the development of, the fetus. As such, the hormones definitely play a major role in the growth of the fibroid. For instance, when we evaluate the hormonal composition of a woman without fibroid and that of the woman with fibroids, there are always differences. And the progesterone, the estrogens that are responsible for preparing the uterus for growth, we find that they are also at that level of it's like the body feels that, okay, this uterus is carrying a baby, is carrying a fetus, so it will feed that uterus with that information that should sustain that fetus. And as such, if that person can starve the body of the things that would encourage the production of these hormones, then automatically there is a chance that the fibroid will be starved, because if it doesn't get the necessary hormones, because it's not just nutritional supply that the fibroid needs, it also needs these chemical supplies from the hormones. So we need to look at it from all angles. So we advise women stay away from foods that would improve the production of these hormones, such as alcohol, such as nicotine from cigarettes, caffeine from coffee. We've talked about eggs, and then you also look at the cholesterol level, and you get that from eating too much fatty meats, like beef, like a lot of turkey. When you are going to eat your poultry, we advise them on how to process their poultry to reduce the cholesterol content in it, so that as much as possible you are not feeding the fiber. The diet of a pregnant woman is different from the diet of a woman without pregnancy. So if you eat so much as to give nutrition to the fibroid will thrive. But when you starve it, it will.
To digress a little, what about the usage of alcohol? Some people say they are using it to burn fats. Now, the usage of alcohol in our bodies, especially for a woman that has given birth, and they introduce alcohol, all this dry gin to shrink. How well does these things work?
Well, when you say how well, I have seen people that they said, I don't like to use the word claim because it sounds like I don't believe what they said. When you have experienced something, you are the best person to relate your experience. I have seen women who told me that after giving birth, they used alcohol to shrink their uteruses. We have it in different cultures, different alcoholic preparations, not just plain alcohol. Alcoholic extracts, alcoholic extracts that they drink as medicines to shrink their uterus. Yes, I have heard about it. I don't use that. Now, there's a difference between alcohol and beer. So most of the time, when we tell people not to consume alcohol, we are usually talking about beer. We are usually talking about this 5% beer that you have in bottles. Whereas for vodka, because vodka is different from beer. Beer is more of, it contains fermented grain products and all of that. Vodka is also fermented, but it contains more ethanol, and it has medicinal properties that we find useful in traditional medicine. We use it to extract. You would hardly find anyone extracting anything with beer. That wouldn't, well, by my own knowledge, that wouldn't form any form of medication. Vodka is what most people use. So when we tell people don't consume alcohol, we are actually talking about beer. And then vodka is not something that people can just consume indiscriminately, because it is highly alcoholic, and most of the time when it is to be applied therapeutically, the routine must be followed. You can't just go and consume 100 ml of vodka, for instance, that will be substance abuse. And then it's even going to affect the stomach linings. It's going to affect the, you know, the tissues along the gut, along the digestive gut. So it will burn, because we know that because of the evaporating properties that it has, it will make that skin, the internal skin, burn. So there is a way we prescribe it, there's a way we administer it, there's a way we advise people to use it. Yes, people use it to extract agbo that is used for the treatment of fibroid and so many other conditions.
Okay. Now, taking it down, how well, before we go into how it can be treated and a lot like that, how well should a woman, or when should a woman start paying attention to her body? What symptoms does it come with? So that anytime someone sees the symptoms, and you will know that, okay, this is what is happening to me, or I should go for a medical checkup.
Most of the time, the symptoms to look out for when fibroid has started to grow in the uterus, the first thing is irregular menstruation. Now, every woman has different menstrual cycle. It ranges, some even have 15 days menstrual cycle. You find some women menstruating twice in a month. It's between that 15 days and 30 days. The most popular is between 26 and 28 days. So once you find out that your regular cycle of, for instance, 28 days is becoming, and then you're beginning to see your period twice a month, or you are beginning to see it once in 2 months, that becomes irregular. It is time to start paying attention to yourself. That is one. Another one is pain, especially when the woman starts to feel pain during ovulation. Very sharp abdominal pain below the navel, either on the right or on the left side of the, abdomen. When you start to feel that sharp pain, that is another thing to look out for. Don't wait till it gets so bad. At times I wonder how anyone would wait for so long and would be saying, I didn't know. I mean, the signs would have been there. Then another thing is, when women start to grow these tumors, they may find intercourse very painful. Once that starts to happen, it may be as a result of anything. Painful intercourse could be as a result of STI, it could be as a result of even cervical cancer, it could be as a result of ovarian cyst, as well as fibroid. So the moment you're beginning to feel these things, it is time to visit your GP. Most of the time, the first step to take, go to any diagnostic center and ask that you want to do a pelvic scan that will show exactly what is going on in your uterus. You can walk in yourself and request. It's a non-intrusive procedure. You just lie on the bed, they will put some stuff on your belly, and they will be able to tell what is in your uterus. With that, you can decide that, okay, it is time, with that result, that is enlightening enough. You can now take that result to go and see your doctor and say, okay, they say that I've got this in my uterus, and then you can begin to live a healthy lifestyle, make better choices, and of course, who knows, you might get better with that.
Now, going the contemporary and alternative, well, whatsoever we might say, it is still medicine. Yeah. Going that way, what are the certain things that can be used, or the ones that you can say, although there might be some other things that might be hidden to avoid abuse from people. But I'd like you to talk more about the alternative and contemporary medicine.
I would really love to give a tip to women out there who are suffering from fibroid. Like I said earlier, the first thing when you notice irregular menstruation, painful intercourse, or painful of ovulation, is to walk into any diagnostic center. Diagnostic centers are those places where they do scan for pregnant women. It's the same process. So you walk in there, do your scan. The moment you observe that there is a fibroid growing in you, what I'm going to give is for early stages of fibroid, for the small sizes, not for those massive ones. Once it begins to get really big as maybe up to 8 centimeters, which is 80 millimeters, you need to go and see your doctor. It is very important. But if it's maybe 20 millimeters, 2 centimeters, 3 centimeters, when you wake up in the morning, make sure that your first food is a glass of warm water with a whole fruit of lime. They call it osanwere or some guin or something like that, or some wewe, which is lime, the very sour one. Make sure you squeeze the whole fruit, not half, the whole fruit of lime into a glass of warm water, not hot water, because the hot water would denature the vitamins in the lime juice. So squeeze that into warm water and drink a whole glass of it. About maybe 200 ml of warm water is sufficient. Make sure that is your first meal, and don't eat anything until after 30 minutes of administering that mixture. Another thing that you might want to prepare is, I believe we all know water leaf. They call it bure in Yoruba. I don't know the other names for it. I hope people would be able to it's a very common vegetable. In fact, it grows wildly by itself. It grows as a weed in some cases. Get fresh leaves of water leaf and blend it in this same lime juice. You could get about 200 ml of lime juice and 2 handfuls of water leaf, fresh water leaves of water leaf, and then blend it in it, filter it, and drink about 100 ml once a day. That only works with small fibroids. And then another thing we need to let women understand is there are different types of fibroids. There is the one that grows inside the muscle, inside the uterus. There is the one that grows outside the uterus. There is the one that grows within the muscles of the uterus. So the ones within the muscles, they call it intramural, then the one inside submucosal, and then, So when the one that the lime water leaf mixture works for is the one that grows inside the uterus. If it's growing within the muscle, if it's growing outside the muscle, please see your doctor. Don't try to do some home remedy and then allow the tumor to grow out of hand before the doctor begins to pay attention to it. Of course, there are traditional mixtures that are used for these things. Some of these mixtures would even see the woman more like maybe when she's going to have a toilet run in the morning and she's trying to poop, the thing will just pop out of her after she has been using the medication. That is for more complicated cases. But the one that you can take care of yourself in the house, once you see that you're beginning to have these signs that I mentioned earlier, is the lime juice and the water leaf. Make sure that you do the warm water lime mixture. It's your first meal in the day, and then you are not eating anything until 30 minutes after administering that, and then you could use the other one anytime during the day, 100 ml once a day.
I want to appreciate all the information that you've given to us. Those information are so vital to our living, and I want to appreciate you for being so resourceful. And I hope our viewers at home will stick to it and make use of it to stay free or stay safe from fibroid. Thank you so much for coming on.
Thank you for having me. It's a pleasure. Anytime.
And that is a wrap on today's edition of African Contemporary and Alternative Medicine, AFRICAM. Stay tuned and join us same time next week on another edition of AFRICAM, where we'll be coming your way with another exciting topic. I am Oluwaseun, and do have a wonderful day ahead.